Dyersburg has had the opportunity to be a Pioneering Healthier Communities, YMCA, and communities. It's a policy and environmental change strategy team.
Hello, Dyer County. I'm Susan Cooper, Commissioner of the Tennessee Department of Health. I'm so pleased to welcome you all to this very exciting day of activities.
You know, when y'all first became a Pioneering Healthier Communities, I remember some folks were concerned that, you know, you're rural, you might not be able to do much. In fact, you're going to be able to do more as a rural community with this work. You're really at an advantage. And you really, really are. The spirit of the community in your rural communities is much greater than in your large urban areas. Your leaders are usually more accessible. So you've got some great opportunities here to really make a difference.
As Ted mentioned, obesity and its resultant diseases are massive, harmful to the public's health. We need to take some collective action now. I mean, it's causing some very critical diseases: diabetes, heart disease, the #1 killer among women, cancers. So what we've done is create environmental conditions that are overriding our regulatory systems, so that it's not just individual responsibility. We've also created default conditions within our lives which contribute to obesity. So what we need to do collectively is to start to create conditions that are conducive to making healthier choices which support personal responsibility. Again, it's the blend of the personal and it's the collective.
85, 86, 87, and you can see this progression of our obesity epidemic. This looks a lot like an infectious disease. It looks like a lot like the flu epidemic spreading through our country every single winter. The problem is there's no vaccine for obesity. There's no medicine to treat it. We're getting up to about 30%. And there we are in Tennessee. That's 2008. So more than 30% of the adults in Tennessee are obese. Since the 80s, our obesity in adults has doubled, but in children, it has tripled. As we know, obesity comes with other diseases. One of the most common ones that people know about is diabetes. And this is the top chart, our obesity spread. This is the bottom part, our spread of the diagnosis of diabetes. And obviously, the diabetes has increased dramatically also. So direct correlation between secondary health consequences and obesity. Within West Tennessee, we cover 83 zip codes. We take care of children from Lake County down to Shelby County and as far east as Benton County. And we have kids coming in from Missouri and Kentucky also. Within that 6 months of data, we had 4,541 patient visits. Out of that, we only took the 2-year-old to 8-year-olds, because that's the kids we can measure BMI. And what we found in my clinic is in 2-year-old to 8-year-old, 14% of my children were overweight and 20% were obese. And that's based on the CDC curve of being over the 95th percentile. In my 9 to 18-year-olds, 13% were overweight, but 34% were obese. Health-wise, they have a lot of cardiovascular effects: high cholesterol, blood pressure, and sugar intolerance. 70% of our obese patients have one of those factors, and 39% have two. These are children with high cholesterol, high blood pressure, or sugar intolerance. Other problems such as asthma, fatty liver, sleep apnea, progression on full type 2 diabetes, and orthopedic complications. As mentioned earlier, today's third graders will have a shorter life expectancy than their parents, and that's purely related to these health conditions. So we have to stop this, we have to change this. So we want to educate our community, our parents, everybody about this epidemic. All of you have seen what has happened to our maps in the country in the last 30 years. You can tell 10 more people, and they can tell 10 more people. And if we can get the word out that this is true, this is real, this is dangerous, then it might actually institute some change. To do all this, really, we have to change policy. Sure, individuals can make choices, and they need to make choices, and they need to be accountable. We as parents have to think about what we're feeding our kids, how much time they're spending on the computer and TV. But if we set policy into place, it will make it easier for us to make those choices. If the child care settings in the schools are mandated to have healthy choices, to not have access to any soda, to not have chips at the checkout line, to not use candy as a reward in our schools, that's going to help. Somehow we would like to bring in access to healthy foods, access to healthy lifestyles, so that we can make it easier for our families and our children to grow up healthy. Because like I said before, none of these children made this choice to become overweight or to become obese. And their parents didn't want this to happen to them either. This is the environment in which we live, and we need to do everything we can to change it.
Y'all have learned from these other speakers about the problem, the obesity epidemic right here at home. And what I'm hoping to do is just get your minds working about how you can do some things to solve it. A lot of it is policy, and policy is a big thing. One of the things we started in 2001, and at that point in our history of Hernando is when we were just starting a growth spurt. We put in a policy that mandated sidewalks in all new development and in redevelopment. It sounds easy. It wasn't easy at that point. The developers come out and want to kill you. The interesting thing is, after just 1 year, the developers were thanking us for doing it because they're selling their houses for more and the property values are staying higher. But what happened because we put that policy in place is 9 years later, I've got 23 miles of sidewalks that I wouldn't have had if we didn't have that policy. It's huge. What you can do today, I don't know if y'all have that policy or not, but if you don't, wherever you go home to, now's the time to put it in place. I'll set asides of land. If you come into our town and do a planned unit development, you have to set aside 10% of it in open space. That's for the health of our community, the overall health, not just the physical health. It's just good for the community as a whole. People need a community that feels safe. They need a community that feels walkable. We have something called design guidelines, and it may seem way off topic, but it's not. When you build something that looks solid and is on a human scale, people will walk more actively. Well, as a mayor, the first question I ask is, why'd you move here? I always want to know, why did you move to my town? What are we doing? You would not believe how many of them say, we moved to Memphis, got a job transfer. Y'all may get some of that here. People transfer into Memphis for jobs. They get an apartment for 6 months and look around and figure out where they're going to live. In a lot of cases, they decide they're going to live in DeSoto County, Mississippi. And then they look specifically at my town and realize we're the one that say we're the healthiest. And they move there because of our culture of health. As elected officials, part of what we're charged to do is to provide for the health, safety, and welfare of our citizens. And that's where I think my role is. My role is not to tell my citizens they have to be healthy. You don't want to fall into that. People have personal choices they need to make. But if I'm not providing them an opportunity to be healthy, I'm not doing my job.
I want you to know that Pioneering Healthy Communities, Coordinated School Health, Parks and Rec, everybody that's represented in this room today, the hospitals, I could just go on and on and on. And I think Dyersburg and Dyer County is perched right on the edge of really greatness for rural counties in Tennessee.
As we're talking through all of this, think about different strategies of how we can reduce the burden of obesity in our state. Our statistics are extremely poor in our state right now. It's not something that we have to dwell on, but it's something that we have to be aware of. At the same time, though, we have a lot of great tools and resources that are available that we can use in order to affect the change. We just have to make the decision and make the commitment to do it.